Go ahead.
Hello, namaste. Welcome back, everyone. Today's class, we're going to be continuing on with Arśas or hemorrhoids, and we're going to pick up on talking about the types as per Ayurveda, as well as we're going to get into the actual treatment aspect. Hopefully, we will have some time to be able to talk about, discuss this whole topic and get some of your questions answered. So you can type your questions in while things are going on, but just remember there's still some more that we need to cover, so we may be able to even answer your question in the process. And if not, that's fine. I will get to it towards the end of the class, so just to get through the material first. Okay, so I think we have a question here. Let me just check this one question. Are colon polyps considered Arśas? Second, you have said that sesame seed and jaggery is a causative factor. I thought that this recipe is prescribed for anemia. Sesame seeds and jaggery. Yes, those two are actually, it's heavy to digest, that's why. Last week's question, okay. That's fine. Okay, so what we're going to do now, we're just going to get back into the topics, and I will answer these questions towards the end, if that's okay. Okay, so I'm going to go ahead and share the PowerPoint, and so hopefully all of you were able to get a chance to either download the PowerPoint. If not, it's going to be on the screen, so you can take the notes accordingly for anything that's not on the screen or not on the PowerPoint. Okay. There we go. Okay. Okay, so previously in the last class, we left off here at the Purva Rūpas, or the premonitory signs and symptoms. And that kind of talked about, some of the signs that you can notice before there's actual presentation or manifestation of the disease. One thing you're also going to notice here, the next slide is about the manifestation of disease. So for instance, in any disease, not only for Arśas, but any disease that we talk about in Ayurveda, you always have the first one primary symptom, but through which we have actually named the disease. And we understand that that is the major cardinal symptom of that condition. So for instance, in this condition, the cardinal symptom is the pile mass, and the actual condition is known as Arśas because Arśas is that which grows out of these tissues such as tvak, mamsa, and medas, and creates a small mass, or as they say, muscle growth that blocks the passage of excretion of the fecal matter and creates a lot of pain and discomfort. That's why it got the name Arśas, because Arśas means that which is like an enemy that causes pain and discomfort. Okay, so the major sign and symptom, or the cardinal symptom of this condition is the pile mass. That's how it got the name Arśas. However, as you've seen now, there are many, many other associated symptoms which are known as Paratantra. So the cardinal sign or symptom that you have for any disease is known as the Swatantra Rūpa, or the primary. Rūpa means that which is shown, or the sign or symptom, and Swatantra means that which is primary, or the first and foremost. And the other associated symptoms, or the other symptoms that we know that can be found in this condition, is known as the Paratantra Rūpa, which means it is secondary. Okay? This is important to know because we're going to be looking at a lot of signs and symptoms here. So even though you have these different types of Arśas, it can present either as a Vātaja type or a Pittaja type or a Kaphaja type, also Sannipata, which means a combination of all three doshas, or even a Raktaja type. So in all of these, you will have the primary symptom, which is the pile mass. All of them, they have a pile mass, therefore it is hemorrhoids or it is Arśas. However, there are other associated symptoms. Sometimes these signs and symptoms can start exhibiting in the patient even before the appearance of the pile mass. So, for instance, we're going to be looking at the list of signs and symptoms for Vātaja Arśas. Sometimes you're going to find the other symptoms that is not necessarily attributed to the pile mass, but may be attributed to indications of an increase of Vata that will happen in the person before there is actual manifestation of the pile mass. Sometimes those symptoms appear at the same time when the pile mass has manifested, and sometimes these symptoms come on after the pile mass has appeared. So the main thing to remember is this is a good indicator that, for instance, if the disease hasn't gotten to the later stages of samprapti, it hasn't gotten to the 5th and 6th stage of samprapti, but you start to see these signs and symptoms in a person, that indicates that they're heading down the path of maybe developing Arśas. So, for instance, if someone has gurgling in their stomach, they have an irregular or decreased appetite, they have this issue with gas, and they have this irregularity of passing stools. Sometimes it happens, sometimes it doesn't. Sometimes they feel the urgency to go, but nothing comes out. Or when it does come out, it's very little quantity and they don't really feel like they've gone. All of these are indicators that something is happening, but it hasn't gotten that much strength to start to manifest. It's on its way to manifesting. If the person keeps on doing what they're doing, if they constantly still have the same ahara vihara or the same sort of diet and lifestyle that is contributing to an increase of vata or contributing to this samprapti, then it will keep progressing to the point where it becomes an actual full-blown hemorrhoids or formation of a pile mass, and then be named as Arśas. Okay, so it's important for us to learn these signs and symptoms because these are great indicators that the disease may be forming even before they actually get a pile mass, or they can really say, okay, yes, I definitely have hemorrhoids. Hemorrhoids is it's a condition that's kind of hard to miss. If you have it, you definitely know that you have it. But the good thing is that we also know how to figure out before the person even has the pile mass. And then that makes it easier for us to be able to correct that condition. Okay? So, this is basically what I've described here, is that these associated symptoms are great indicators. Okay, so if the client has multiple signs or symptoms associated with this condition, but does not present with a complaint of hemorrhoids, then you can understand that they're on the pathway to the development of Arśas. Okay, so the next is the amanya Rūpa, or the general signs and symptoms. These are not exclusive. So this is exactly what I was telling you, that you can find some of these symptoms even before it becomes specifically a Vātaja type or a Pittaja type or a Kaphaja type. Okay, or these are also just indicators that the person may be developing Arśas. So some of the amanya Rūpas, or the general signs and symptoms of this condition or of this disease, is emaciation or lack of nutrition. That is krisha brasha, which means, so for instance, this is a great example because I actually experienced this myself. When I was in India, at one point, I had a very bad fever. I think it was due to either I got bit by a mosquito or it was a really bad viral fever. I had about 104-degree temperature for continuously for about 3 days. And within those 3 days, I lost maybe around 10 pounds. It was so severe. And so finally, someone came in and they gave me some medicines and it caused the fever to go down. However, within such a short period of time, I had lost a lot of weight and I had lost a lot of my stored nutrition. So after that, even though the fever was gone, there was still this lack of nutrition in my body, and it caused me to develop very small pile masses. I had never had piles in my life before, but it was the first time that I actually experienced this, and it was brought on because of the fact that that fever that I had really caused a sudden decrease in nutrition in my body and a sudden onset of emaciation or lack of nutrition or sort of depletion. And because whenever there is depletion, that causes an increase of vata, that's exactly what brought on then the formation of the pile mass. Because the vata was so increased, there was nothing, my body really wasn't retaining or was able to digest any food, and I could barely eat any food. I had no sort of appetite. That when I did eat, it was being stored in my body for a longer period of time. I did have constipation. I was passing very little amount of stool. And when it did come out, it was so dry and so hard that it ended up developing these small pile masses. I had ended up with 2 small pile masses. And it was within the same month that this happened. At the beginning of the month, I had the fever, and by the end of the month, I ended up with this presentation. So this is a great example of how an immediate loss of nutrition or depletion in the person's body can cause Arśas. So these act as signs and symptoms, as well as these can also act as causative factors as well. Okay, so even though it indicates that this is the symptom that I had, the symptom I had was lack of nutrition or depletion due to another disease, which was the fever, but that eventually led to the formation of Arśas as well. Okay. The next one is lack of enthusiasm. Now, this is a symptom that you're going to find if someone is either in the 4th or 5th stage of samprapti, and they actually either are about to develop the pile mass or have already developed the pile mass. They're going to have this sort of symptom, such as lack of enthusiasm. Oh, hatotsaha, that is the Sanskrit term. Ati nishprabha means profound loss of complexion, because remember, even in this condition, the root cause is a depletion of the Jataragni, or a very low presentation of the Jataragni. And the Agni, one of the major functions of Agni, is also for complexion and glow and health of the skin. So if the Agni itself is depleted, it immediately starts to show up in the complexion of the person. So when the person has Arśas as well as Grahani, there will be loss of complexion, which means that there'll be loss of that glow and that natural health of their skin. Asaro, which means there will be lack of absorption from the nutrition. From whatever you're consuming, there'll be lack of absorption of nutrition from the rasadhatu onwards. The rasadhatu is not getting the proper nutrition. It's not absorbing that from the ahara rasa, and none of the other dhatus will be getting nutrition either. Okay. The next is kritsano upadrave gratso, which means it's afflicted by many secondary complications. But if a person has hemorrhoids, it can very easily develop other complications as well, or other diseases as well. Marma pidana means there will be pain in the marmas. Not necessarily all the marmas, some of the associated marmas that are very close to where vata functions. In all of those places, the person may feel pain or sensitivity. Kasa, which is coughing. Pipasa is thirst. Vairasya, the bad taste in the mouth. Shwasa is dyspnea or respiratory issues. And Pinasa is rhinitis. So all of these conditions, even like Kasa and Shwasa, or coughing and dyspnea or respiratory issues, the causative factor for those conditions as well is the same as this, where it is due to Manda Agni. Okay. Other signs and symptoms that are associated with this condition is vague pain in the body, vomiting, excessive sneezing, which is again just an indication of vata moving outward, vata initiating that urge of sneezing. But because there is an aggravation of vata, it causes the vata to move out more. That's why you have the excessive sneezing. Edema, fever, urinary caliculi, which means it's many stones or granulation formation in the urinary bladder. That happens because vata, again, is very aggravated. This is an issue directly with the apana vata. So not only apana vata in the colon moving downwards, but also apana vata in the vasti or in the urinary bladder that also starts to move around. And because of that constant movement, it starts to dry out or to concentrate the urine that is stored and that's waiting to be excreted. So instead, you'll also notice that the urine tends to be more concentrated than it can present in both ways. Either there's frequent evacuation of urine, like there's an urgency that the person needs to go a lot. Otherwise, it may also present as very little urine output, and when they do urinate, it's very concentrated or it's a very dark color. And that indicates, again, the vata that's moving around and actually drying out the liquid consistency or the viscosity of the urine, therefore drying it out, therefore making it more concentrated, and therefore forming these granulations. Okay, the person may also have a feeble voice. The voice may be feeble as well as hoarse. Loss of appetite, of course. Pain in the joints, again, that indicates just an increase of vata. Pain in the joints, in the bones, in the region of the heart, in the anus, groin, and umbilicus. And that, again, all of these places, it just indicates that vata is not moving out downwards in its appropriate direction. So therefore, it starts to circulate and move in other directions of the body, whichever way it can go. And when the vata starts to move upwards or move outwards, it starts to create more pain and discomfort. Okay? Anxiety, of course, that is a direct relationship of vata affecting the mind. A very typical sign and symptom of when there's increased vata, it causes disturbance of the mind, and the mind starts to flow in the same sort of rhythm and sporadic nature that vata is also moving. So therefore, anxiety and worrying. There may also be an exudate from the rectum, and that just indicates when the pile mass is forming, there will be some amount of fluid that starts to come out from the rectum. The pile mass is either seen or it's coming out at the time of defecation. It's usually moist. It can be with, or even in certain cases without, an exudate. These are some of the general signs and symptoms of Arśas. Okay, Now getting to the specific signs and symptoms of Arśas, which is specifically for Vata, for Pitta, and for Kapha. So in the classical text, in Charaka Samhita, he has mentioned, even apart from just the specific signs and symptoms for Vata, Pitta, and Kaphaja Arśas, he's also mentioned in Charaka Samhita the specific nidana for these types of Arśas. Because Arśas is one of those conditions that started long ago. It's basically an ancient disease. So from the time or the beginning of creation, Arśas was always around. And so therefore there is a very detailed description about what can cause Arśas and how it may present in different manners. So this again goes along very well with what we have already looked at in the specific causative factors for the different types of grahani. It's the same sort of concept that has been enumerated here. So for instance, intake of kashaya, tikta, katu, ruksha, shita, and laghu foods, that is astringent, bitter, pungent, dry, cold, and light foods, all of those things aggravate Vata. Habitual intake of either less quantity of food, alcohol, or excessive sexual acts, all of these again aggravate Vata. Fasting, residing in extremely cold climates, or in the cold season, or excessive physical exercise. Grief and too much exposure to sun and wind. All of these are specific nidanas for Vātaja Arśas. And this is very common with exactly what we've learned, all of the different causative factors or different things that aggravate Vata. Okay? So if the person has or is exposed to these sort of habits, then it will cause an aggravation of Vata, along with the same samprapti that we know, that there is Manda Agni that then causes a malnourishment or the Apana Vata to start to move upwards, and therefore it's causing this formation of Arśas. Okay? So in Vātaja Arśas, the signs and symptoms are the pile mass will be very dry. It tends to be shriveled, maybe a bluish red color. It can be coarse and hard, and sometimes there may even be cracking in the pile mass. There's usually a tingling sensation around the anus. This is one of those symptoms that can be an indicators before even the pile mass either appears, or if the person has an internal pile mass, but we don't necessarily know for sure yet. The tingling sensation around the anus is usually one of those indicators. Headaches and pain in the flanks, shoulders, waist, thighs, and groin. These are, again, excessive movement of Vata, so these are the signs that you'll find with that. Stasis of food in the GIT without digestion, because what happens is, again, due to all of these factors, there's an increase of Vata, but it has also started to affect the integrity of the rectum and the Guda Oshta. Remember, the last part of the rectum that is responsible for opening and allowing the fecal matter to go out and then closing back again. So what happens is that all of these factors tend to affect the integrity of the muscle to be able to do that regulating action, as well as it dries out all of the typical amount of mucus and moisture that would be there in the rectum that allows for free flowing of the fecal matter outwards. So what happens is, instead, it's too dry, it doesn't have the amount of elasticity in the muscles that it had before, so it tends to hold on much longer, and therefore the food or the undigested food stays in the GIT for longer. Only if one output goes out, then the others that are higher up in the GIT can also move down. If output isn't happening, then that which is in the middle part of the GIT also can't move down. So at multiple layers, or multiple areas in this very long tract, there will be food that is sitting there that is undigested and that is waiting for one to move out so the next one can move down. Okay? So in that way, another kind of, this is just from practical experience, when we were learning this, we got to do examination on patients, but this is something that you can even ask, that when someone is about to start developing hemorrhoids or they already have it, you can ask them if the anal opening, if it tends to be very hard or if it seems like it's not opening at all. So that seems like a weird question, but what they will say is, or what you can ask them is, for instance, when they try to pass stools, is it really hard for them to pass the stools? Do they have to kind of force it out? So what they'll say is that I feel like I need to go to the bathroom and I feel like I have this urgency, but when I get there, nothing comes out. And I sit there and I wait and I try to wiggle or I try to force it out, but then nothing comes out. It just feels like something's blocking and it's not coming out. That indicates, again, that stiffness of that sphincter muscle and the dryness that's there, that's not allowing it to freely move out, and it's not allowing the opening to actually open, to the orifice doesn't open to allow the stool to come out. Okay? So that's kind of a typical indicator that the person does have Arśas, even if the pile mass is not coming out and you can't actually see it, or the person can't actually feel it, but that just that tightening of the anal opening, that indicates that they're very much on their way to having this, or they already have it. Okay? So again, there'll be constricting pain in the region of the heart, and that just indicates that, again, Vata is moving upwards and it's moving very sporadically. Coughing and breathing irregularities, abnormalities in digestion. That means sometimes it's regular, sometimes it's irregular, sometimes there's no hunger at all. Remember when we talked about how when the Apana Vata moves down in the appropriate time, then it gets a chance to then move up freely, which then becomes the Samana Vata, which ignites the Agni and tells the person that they feel hungry. And of course, the Jataragni is the main factor responsible for digestion. So when this Vata is moving all over the place, it's not moving downwards, not getting rid of what is there in the tract, then whatever's there in the higher parts of the tract doesn't get to move down either. And so then if something is blocking in the tract, the Apana Vata can't move up freely to become the Samana Vata to ignite the Agni. Okay? So just try to visualize that process in your head, and it'll become very clear as to why these signs and symptoms have been indicated and why the person feels the way they do. Okay? They'll have buzzing sound in the ears. When voiding stools, the quantity may be less, or it comes out like pellets, and sometimes it's accompanied with sound, or it's painful evacuation and also unsatisfying. Gas, urine, and stool always feels obstructed because Apana Vata isn't moving down. In order for any one of these things to move out of the body, Apana Vata is necessary to do that. So Apana Vata is not moving down. That's why it always feels like it's instead just getting stuck there and it's moving about. So even gas, you feel the person has gas, they have it, they want to let it go, but it's not, the sphincter itself is not opening to allow it to move down. The urine won't move out freely because even that Apana Vata function gets aggravated, and the stool obviously will not move out freely. There'll be hyperpigmentation of skin here, because in Vātaja conditions, when it becomes full-on Bheda stage of Samprapti, where we know it's definitely due to Vata, or it is a Vātaja condition, then aggravation of Vata tends to, again, dry out and take away that proper nutrition of these different places in the body. Therefore, it causes darkening of these areas. So hyperpigmentation means there'll be darkening of the skin. Usually you'll find it around their knuckles, or you'll find it in the extremities. You'll find that in the knuckles, near the joints, the skin tends to be darker than in other parts of the body. And also you'll find the darkening in the nails. Sometimes you can tell the difference between their nails. Have you ever seen people that have like a slight darkish color on their nails? Of course, sometimes it's hard, you know, if they have nail polish on. But if they don't, in one or two of their nails, it may seem darker than the other nails. That's an indicator that there is definitely an issue with Vata. Okay. Clearly, of course, hyperpigmentation of the eyes, the dark circle under the eyes. Anytime there's dark circle under the eyes, it automatically means that there's an issue with Vata. It could be Vata anywhere in the body or any one of the functions of Vata. But whenever there's dark circles under the eyes, it's always an issue with Vata. Okay. Of course, hyperpigmentation in the face, hyperpigmentation in the urine, which is basically Vata drying out the urine, and in the feces, in the fecal matter, it'll be more dark in color. Okay. If left untreated, it may also produce secondary conditions like gulma. Gulma, remember we were talking about it, it's kind of like, it seems like a phantom tumor where the abdominal distends. So it can be very loosely translated as abdominal tumors, but it's not all abdominal tumors, and it's not only abdominal tumors. It can also just mean bloating or distension of the abdomen or accumulation of gas. There are multiple ways to describe what gulma is, okay? It doesn't fall under only the realm of abdominal tumors. And the next is it may also produce enlargement of the spleen, of course, of the abdomen and or the prostate. And Charaka has specifically indicated that the person feels relief with snigdha and ushna substances. So for instance, if you use a warm oil applied on the anal region, then they will feel relief from that, okay? They will feel relief from the pain and all of these, somewhat of these symptoms. Okay, so that's the Vātaja type of Arśas. The next is the Pittaja type of Arśas. So in here, the pile mass will be blue, red, yellow, and or black. It doesn't necessarily mean that it has to be exactly one of these colors. It may be a combination of these, either one or two or all of them. Okay, it's associated with an exudate of sort of like a clear exudate with some blood mixed in. So it's somewhat like serum mixed with, tinged with blood. The pile mass tends to be thin, soft, and supple. It's not as big. So Vātaja tends to be more rough and not necessarily so round. It's sort of an irregular shape. The Pittaja tends to be more smaller and thinner. And we'll see in the next, the Kaphaja tends to be very round and large and hard, okay? There tends to be an association of burning sensation in the body. This is, again, an example of the Osha Plosha, where in Pittaja Arśas, they feel like there's hot fumes circulating all over the body. So Osha Plosha is a good example of the burning sensation what the person feels in the Pittaja type of Arśas. Ulceration in the GIT or in the skin, that just means that the soft tissues start to separate. They start to become ulcerated or start to break down because of the extreme heat in the body. Also, the person may develop fever, thirst and perspiration, fainting, loss of taste and appetite, delusion, again because of the extreme heat, stools come out more warm, watery, yellow, or red in color and partially digested. So even though the person has hemorrhoids, they can still end up having this issue with their stools being watery. It doesn't necessarily mean that it has to be constipated at this point. It could have been constipation in the beginning, but by the time it gets to this stage of samprapti where it is termed as Vātaja Arśas, at this point, it doesn't necessarily need to be constipated for the person to still have the hemorrhoids. So you'll see this depending on the chronicity. Some clients come in and say, well, I have piles, but I go to the bathroom fairly okay. You know, I don't really have a problem going to the bathroom, so the piles doesn't really bother me. So that, again, you can see that it's not always that if they have piles, they will be constipated. You can also have piles and still have a watery stool, okay? The person's skin and nails will also assume the same color, similar color to that of the stool, sort of either a light brown or greenish or even a deep yellow, okay? Greenish yellow or a deep yellow. The urine and stool is voided in large quantities and it smells like raw meat. What they mean by raw meat is it has that sort of smell of blood, which you'll find in Vātaja Arśas. Now, what they say here is in Vātaja Arśas, and we'll look at this in a second, the difference between Vātaja Arśas and Rūpa Arśas is that in this type, you may get some exudate that is stained with blood, but in Vātaja Arśas, it is where there is actual bleeding. It is a bleeding type of piles, okay? So in Vātaja Arśas, it's not necessarily bleeding, but in Vātaja Arśas, it's definitely a bleeding presentation of piles, okay? And of course, the person tends to feel relief with cold substances. So that is Vātaja Arśas. The next is Kaphaja Arśas. So in that, the pile mass, as it just mentioned, the pile mass will be very deep-rooted. It's thick and hard. It's round. It has more of a whitish color. It's bulging, immovable. It's not necessarily moving out, whereas, you know, the one with Vata can prolapse and come out, or even the Vātaja can prolapse, but the Kaphaja tends to not prolapse. It'll be very large and it just sits there. It's immovable, heavy, slimy, smooth, and associated with severe itching. So that's how it would present with the pile mass. The person also tends to have the urge to scratch or to touch that area because they feel like any sort of movement a little bit from it would help to relieve or sort of reduce some of the discomfort associated with the piles or the pile mass. It results in also swelling of the groins, a cutting pain in the anus, urinary bladder, and umbilicus, coughing and breathing difficulties, nausea, excessive salivation, loss of taste and appetite, dull headaches. All of these, again, even in the Kaphaja Arśas, though it's predominantly kapha sort of symptoms of the disease or of the piles, you still have the primary dosha or issue that's affected here is still Vata. So you'll get Vata sort of symptoms with more of a Kaphaja sort of presentation. Because remember, in this disease is manifesting in the home of Vata, in the domain of Vata, and also specifically affecting the Apana Vata. Okay, so we've got a question here. For Vātaja Arśas, relief with cold external application or internal intake of cold or both? That's a great question. So external application of mild cold or cooling things, but not extreme cold, because even extreme cold also is a causative factor for Arśas. Do you remember when we talked about in the Nidana that if the person is constantly being exposed or using extreme cold things to wash the area, that can also cause Arśas. So it's sort of cooling things. So for instance, a SIDS bath, but in a sort of a more room temperature water, that would help to relieve it. And cooling things, yes, taken internally. So a great example of this is takra, because takra makes you feel very cool as you're drinking it, but it also does not kill the agni. It helps to ignite the agni. So that's why things like that that reduce your body temperature or reduce that burning sensation without affecting the person's agni or suppressing their agni is what would help to sort of reduce or relieve some of their symptoms. So some of the other signs and symptoms of Kaphaja Arśas is fever with rigors. Their body tends to start to be sort of stiff. Impotence, or a low libido. Vomiting. Diseases due to ama, so many other conditions that may arise because of ama, that may also be a secondary symptom associated with Kaphaja Arśas. The person voids stool with mucus and it looks like muscle fat or meat fat. So for instance, the fat that you get, the ribbing, I think it's called, or the fat that you find between really thick layers of muscle in meat, that it looks like that, or it looks like that thick layer of fat that you get over some types of meat. That's what the stool will end up looking like. And the person has to strain to pass the stool. There usually isn't much bleeding from the piles or break in the skin around the anus because of the excessive moisture or the nature of the Kaphaja Arśas. It'll be very stagnant and very large, but it's not usually associated with bleeding. Okay, and the anus tends to be, it's a yellowish whitish color and it's quite greasy. Okay, so this is again another thing to ask. Sometimes when people have these type of pile mass, they may not necessarily see it. They obviously feel the discomfort from it, but one thing to ask them is if there's ever any staining in their underwear, because even when they're not going to the bathroom or they can't necessarily pass stool, they can't go to the bathroom, but this exudate is there, so the exudate comes out and it tends to stain, or it shows up in the underwear. So this is a good thing to ask them if they have any such symptoms, that if they're staining in the underwear. Okay, and if so, what color, or what is it like? I know, not very fun things to ask, but these are good ways for us to understand what is the actual presentation of the disease. Okay, and Vātaja, which is the combination of the three doshas, can usually, in the classical text, they haven't described too much about Vātaja, because you will find a cross-referencing of almost all the symptoms, or some of the Kaphaja symptoms, some of the Pittaja symptoms, and some of the Vātaja symptoms. Okay, so Vātaja is usually a combination of the symptoms from the three doshas, or the three dosha types of Arśas. The next is Raktaja Arśas. So Raktaja Arśas, the reason that they have given this a separate classification is not necessarily on the nidana for it. The nidana or the causative factors is the same. It's because of the presentation being different than the other types of Arśas. In Raktaja Arśas, the piles is due to aggravation of Rakta Dhatu, which is very similar to that of Pitta dosha, similar to the symptoms of Pittaja Arśas. However, in Raktaja Arśas, it's associated with heavy bleeding of warm and impure blood. So what do we mean by impure blood? We mean that the blood that comes out tends to be much darker in color than the normal sort of reddish hue of what healthy blood looks like. Okay, so you'll notice that they'll say that yes, when passing, there's usually blood in the stool, and the blood tends to be more of a darker color, or it tends to either have a different smell, or doesn't look like fresh blood. That is one indicator. In this type, you will also find that you can have the presentation of fresh blood as well. And when it's usually fresh blood, it indicates that it's a fresh injury. So that can happen, for instance, if the stool is really, really dry and hard. And what happens is, on its way out, it's so abrasive that it causes a fresh injury to the lining, and therefore it causes the fresh bleeding. So you get that normal color of blood in the stools, as opposed to this type of Arśas, where you end up getting the darker or the thicker sort of blood, maybe even associated with clots. The viscosity itself of the blood will be different. It won't be as watery. It tends to be a little bit thicker in this type of Arśas. Okay. Wait a second. We had a question here. And the relief for Kaphaja Arśas tends to be, again, some things that are more dry and warm, because again, that is associated with the opposite qualities of Kapha. So for instance, if you were to use like a warm pad, they get the heat but without the moisture from it. So that would help to reduce some of the symptoms of the Kaphaja Arśas. Okay. Some of the other signs and symptoms associated with Raktaja Arśas, due to the amount of the loss of blood, the person feels diminished in strength and lack of complexion and enthusiasm. And it also causes impairment of the sensory activities. Okay, so these are the presentations of all the different types of Arśas as per the classical texts. Oh, hold on a second here. And next is the Cikitsa Sutra, or the concept for treatment, the line of treatment for Arśas. Okay, so according to Sushruta Acharya, usually we go with Sushruta Samhita for this particular condition because he has given a much better description when it comes to the treatment aspect than the other texts. And the reason why is because most of the treatment procedures, or the best methods for treatment of this condition, is a somewhat surgical procedures or parasurgical procedures. So therefore you find much larger description about the treatment of Arśas in Sushruta Samhita than the other texts. And just in case you guys don't remember, Sushruta Samhita, Sushruta is the father of surgery as per Ayurveda. And so in his text, there is a much larger description of anatomy, as well as other different, layers of the body, and therefore also a much more detailed description about surgical procedures, okay, and instruments and methods that you can use. So in Sushruta Samhita, he has described that there are 4 different methods or things that we can do for treating Arśas or hemorrhoids. The first is Aushadha, which is by using medicines. Aushadha means medicines. Using medicines for pacification of the doshas. The second is Kshara Karma, which is, Kshara means alkalis. So it's application of different types of alkalis. So an example of that is, for instance, alkali is, it's the other end of the spectrum of the pH spectrum, where it's not an extreme acid, but it's an extreme alkali. Both ends of the pH spectrum have the ability to, they're very heating, they have the ability to burn. So an extreme alkali can also cause the same sort of burning effect that an extreme acid can. So what we do is there are a certain number of herbs that naturally have more of a high alkaline nature. And what we do is we prepare a concentrated version of the extract of these plants. And that alkali, usually the way we prepare it, it's in the form of a paste. And that alkali paste is actually applied onto the pile mass. And that helps to sort of create an immediate burning effect. And it kills the circulation of the pile mass, and then it eventually just shrivels up and falls off. Okay? Then this is, again, just for your knowledge. As you can see here, Kshara Karma, Agni Karma, which is cauterization, and Shastra Karma, which is, Shastra means here where we're using a surgical instrument. Shastra means surgical instrument. And karma means the actual procedure. So a procedure using a surgical instrument is a surgical procedure. So all of these later three are, of course, beyond our scope of practice here in the US. However, I wanted to let you know, this is for your knowledge purpose, that these other procedures are out there. In fact, another one that I haven't included in here, but we have done this, and we do this in India, is where we use Shada Sutra, where instead of just applying the alkalis as a paste onto the pile mass, we apply the alkali onto a thread, and we medicate the thread with the alkali paste. And that thread is used we tie that around the base or the root of the pile mass. And what that does is it slowly cuts away at the pile mass until there's no more blood circulation to the mass, and then it falls off. Okay, it dries up and it falls off. So just for your knowledge, these are other procedures that are done. It is practiced in India, of course, here due to our other restrictions where this is beyond our scope of practice. However, we can use the first one, which is different types of medicines or Ayurvedic medicines or formulas. Okay, so in the first aspect where we're looking at medicines, this is key to know because you're going to find a lot of common overlaps between what we learned in Grahani and in this. So piles, diarrhea, and Grahani have the similar root cause. They all manifest due to weak digestive fire. Hence, the first step in treatment of any of these disease conditions is to increase the digestive fire or to increase the Agni. And this is a direct quote from Ashtanga Hridaya in Cikitsa Sthana, okay? Where it's the same causative factor for both Grahani and for Arśas. Oops, sorry. Here, let me just see here. We got a question. There we go. For all of these Arśas kinds, Vata, Pitta, and Kapha and Vātaja are all the piles exteriorly presenting. Not necessarily. Sometimes, so remember in the beginning where we talked about the different presentations of the piles, it really depends on the chronicity and the severity. In certain cases, you can have the pile mass where it's an internal piles, or you can have it where it is midway, or you can have it, it's a pile mass that protrudes and then retracts. And then you can also have a pile mass that is right at the opening that is always outside. And then you have a pile mass that is actually on the outside of the canal. So depending on where it presents or where the root of the pile mass is, you can have different presentations of the pile mass. And that's another thing that they haven't really described that so much in the classical text, that Vātaja is always this type or Pittaja is always this type. Even in the Vātaja, Pittaja, Kaphaja, or Sannipata, or Raktaja, you can have any one of these presentations, either internal, prolapsing, external, or that which is thrombosed. Okay, you can have any one of those presentations, but that's a great question. Any one of these piles can present in any one of those ways. So they haven't described it specifically that this is always this type. So even in those type of piles presentations, you can find even in like an internal piles can be of a Vātaja type, of a Pittaja type, or of a Kaphaja type. Prolapsing type of piles can be this way. I can say this because I've actually, I had the opportunity to see this. I worked in an anorectal clinic in India, and we got a chance to do a lot of procedures. We got a chance to do the Ayurvedic procedures for correcting piles. So in that, I had a chance to see these different types of piles. And like I said, we were allowed to do the examinations there, so we can actually feel the internal pile masses, and we can also use different instruments to examine and be able to see the ones that are prolapsing, that are midway, and those which are just at the border, and they prolapse and then they go back in. So we had a chance to see them, and they do present in different manners. They have different shapes, they have different colors as described by the classical texts. So it's not necessarily restricted. Okay, I hope that answers the question. Okay, so for piles, diarrhea, and for grahani, the root cause for it is, again, decrease of the Jataragni or Mandagni, and therefore we need to, the first and foremost line of treatment is to increase the Agni. So some examples of things that we can do: increasing the Agni here for Arśas, and increasing the Agni in Grahani is exactly the same thing. It's increasing the Agni. So everything that we learned about different methods for increasing the Agni in Grahani can also be applied for the treatment of Arśas. So this is, remember when we were talking about this in class, is that when you're treating Arśas, you do the same treatment as you would for Grahani, and that just seems so crazy. Why would you do the same treatment for these two conditions that seem so opposite to each other? One is excessive bowel evacuation, and one is no bowel evacuation at all, or very little. Then why would you use the same sort of treatment or the same medicines? But this is the reason why. The reason why is because both of them manifest or started because of the same causative factor, an issue with the Agni. So therefore, if you start to increase the Agni, you will have, the condition will slowly start to regress. Okay, so different methods for increasing the Agni: Gandharva Stadi Kashayam or Takra. So the indications for Takra, again, is also there for the treatment of Arśas as well. In fact, we make a medicinal preparation of Takra, where Takra is kept in a vessel along with other herbs, and it is fermented, and we make this combination. It's known as Takra Arishta. Arishta is a fermented drink, which actually becomes sort of a slightly alcoholic drink. It's a self-generating alcohol. So the Takra is fermented, and then that alcoholic preparation of Takra is used actually for the treatment of Arśas. But even if you don't make that, you can still use just Takra alone. That also is very very useful in the treatment of Arśas. So Takra mixed with the same sort of Deepana Pachana spices, the list that you have in the Grahani notes, it's the same stuff that you would use here as well. Okay. After increasing the Agni, you also want to either simultaneously look at Vata Anulomana, or after you have increased Agni, then try to induce Vata Anulomana. And what Vata Anulomana means is that you're trying to coax the Vata to move downward in its normal direction. Anulomana means in the downward direction, or in the direction of which the loma, which is your hair on your body, the direction in which the hair grows, and that is usually in the downward direction. So you want Vata to move in that direction. So there are certain herbs and there are certain combinations that help to, again, induce that movement. Examples of that is Abhaya Arishta. Okay, that is something that you can find here in the US now, again, with the same website that I was telling you. That is a classical preparation. The formula is there in Ashtanga Hridaya under Arśas Cikitsa, or treatment for Arśas. And another example of a Vata Anulomana drug is Avipatikara Churna. And that these are, both of these help sort of coax the Vata to move outwards. Therefore, even if the person is constipated, they have gas, they have distension of the abdomen, they have bloating, both of these things can be used as well. They can act in those conditions as well, and then helping the Vata to move downwards. Okay, Abhaya Arishta is again another one of those fermented alcoholic preparations. Avipatikara Churna is a powder that has some of the main ingredients that actually we even use this combination for inducing purgation or for a virechana type of effect. Okay, Abhaya is it's a good combination, not as strong as Avipatikara Churna. So Avipati is a bit stronger, a bit more potent. So you need to pick and choose where that would be appropriate or not. And just after this, I have the combination. So I'll explain that in a second. And after all of this has happened, after you have increased the Agni and you have caused Vata Anulomana, just by doing the Vata Anulomana itself, once the Vata starts to move out in an appropriate free manner, it will start to naturally help the tissues to regain their natural structure. It will help to then reduce the pile mass. Now, this really depends on the degree of the pile mass and also how severe or how chronic it has been, how large it is, will really determine how long it's going to take to be able to have the pile mass reduce in size and just go back in. When you're using Aushadha method for Cikitsa, what the aim of this is to do is to get rid of the cause for the Arśas, as well as to then reduce the size of the pile mass and have it go back into the normal structure of the tissues. The other methods of treatment that have been mentioned that is out of our scope of practice, the reason they've put those on there is because if the pile mass is very, very large and it's very chronic, then sometimes it's very difficult for us to be able to achieve that treatment with Aushadha alone. And also if it's very painful or causes severe discomfort to the patient, then Aushadha takes a much longer time in those advanced chronic stages than if you were to just do a surgical intervention. So that's why there are other options, enumerated in the classical text. However, with our scope of practice, what we want to try to do as much as possible is to use these different herbal formulas to help to cause Vata to move downwards, and also to try and get the pile mass or for it to shrink and then reduce back into the original structure of those tissues in that area. Okay, so when we are able to do that, then what we want to do is nourish the tissues in the colon. So therefore it will keep its integrity, and therefore it will not cause any further formation of any more piles or pile masses. Okay, so an example of this that really helps is Jatyadi Tela for external application, either application on the anus, or even we can use like medicated tampons or medicated cotton wicks, basically. So it's basically a cotton that's dipped into the oil and that the person can insert as like a suppository that has that's the cotton soaked with this oil that is inserted into the anus, and that allows the surrounding structures to be nourished with this oil. Okay, so that's the main concept as to what we want to do or how we want to approach treating Arśas. So Gandhava Stadi Kashaya, this is there in your notes for Grahani. The major component or ingredient in that is Gandhava Hasta, which is castor. So we use the castor seeds, and we also use the castor root in this. Chiravilva, Chitrika, all of these actually help to pacify Vata. It also helps the Vata to move downwards. So they're all very useful in pacifying Vata sort of conditions. So Gandhava Hasta, as you saw, we use this in Grahani. We can also use this in Arśas. It works very well in earlier stages of Arśas, or in earlier stages of hemorrhoids. The dose is, again, for the prepared kashaya, the one that you can find on the market, and the person would just buy it online. You can use 15 ml of this kashaya mixed with 45 ml of warm cooked water, and that is to be consumed around 20 to 30 minutes before food. I would say around 3 times per day in the beginning would be great, because we want to increase the Agni. So this helps in doing all of that. For instance, the benefits for this kashaya is it increases the Agni, it pacifies Vata, it helps to increase the appetite and taste, as well as it helps to eliminate waste. And that is, for instance, it helps to have that free movement, downward movement of the fecal matter, of urine, of sweat, also of gas. So that's not on the list here, but this really helps to let gas move downwards. So even if, for instance, if the person has some of these associated signs and symptoms, but they're not necessarily telling you that, okay, I have piles or I have hemorrhoids, then even in that condition, this would really help, because they're on the pathway to developing that. So if we catch it early, we can absolutely prevent them from developing hemorrhoids or from it becoming very apparent. Okay, so this can really help in that sort of condition. So the frequency of, so you can do this 3 times a day in the beginning, and then you can taper it off according to how the person is responding or feeling. This works, again, very well for both Grahani and for Arśas. Okay. The next combination is the Avipatikara Churna, which also is available online. There are multiple companies that you can get this from. I know for sure you can even find it on Amazon. And yep, here's a question here. So I've always thought Avipatikara Churna was for Pitta, a cooling blend. Can you explain how this is for Vata? And is it that it just moves downwards? Actually, this is not at all a cooling blend. Avipatikara Churna, the reason why it has been indicated for Pitta is because it induces purgation. Avipatikara Churna is one of the drug of choice, for instance, if we want to induce purgation or virechana. And virechana is the cleansing of choice for pacifying Pitta. So what it does is it causes the excessive Pitta to move downwards. It causes also the Vata to move downwards. Purgation in itself is a downward movement. So that's what this does. If, for instance, if you look at the ingredients in here, these are not in any way cooling at all. Trikatu, the black pepper, long pepper, and ginger, not cooling. Haritaki, vibhitaki, amlaki, that is Triphala basically. Triphala also not necessarily cooling, it's neither way. It's neither too hot nor too cold. Musta is a very hot potency drug. Vidanga is also very hot in potency. Lavana, of course, actually aggravates Pitta. Ela, patra, that is cardamom and cinnamon, These are the only ones that actually help to pacify pitta. Lavanga is cloves. That also doesn't really help to pacify pitta. Trivrit is the one that has the severe reaction of causing that downward movement. And Shakara is the sugar, just to help to kind of balance off some of the excessive heat in this. So this is an example of Tadartakari Cikitsa, where you're using things which are of similar qualities to that of the similar qualities which is actually causing the disease in the body. By using the similar qualities of the already similar qualities in the body, you're helping to pacify the doshas. You're helping to move it down. Okay? So even though we usually think we want to do opposite qualities to pacify the doshas, there are certain conditions where we need to use similar qualities to that of the doshas to then pacify the dosha or the condition. Okay, and this is a great example of that. Even for pacifying pitta, and this is also for pacifying vata, only because this really helps for the downward movement of vata. Okay, so the dose of how you would give this is very potent and very strong. So you really need to see how chronic this hemorrhoid is. If the person has had hemorrhoids for a few years, or if it's been on and off for a few years, and clearly they have this issue with gas, and they have this issue with constipation off and on, and they have this hemorrhoid that comes and goes, then clearly it's at a chronic stage, and in that case you can give them 5 grams with warm water and decide if you need to have them take it twice a day, or if you want to just give them once a day. Okay, so depending on the chronicity would really depend on how many times per day you want them to have it. Ideally, you do not want to do Avipatikara Churna 3 times a day because it's too hot and it's too strong. A maximum of twice a day, and that's in cases where you have a very chronic presentation of Arśas. If it is not as chronic, but the person still has the issue of constipation and gas, and clearly they have a pile mass, then you can give them this once a day. And the time you would probably want them to take this is at bedtime. So they can take this Avipatikara Churna, 5 grams with warm water, just a little bit before they go to bed. Okay? So again, you have to use your intuition, and you have to see according to how chronic the condition is. There's no set rule as to what the dose is and the frequency of how much they're supposed to take, okay? Whether it's twice a day or whether it's once a day. Ideally, we do not want 3 times a day because it will be too much. If you had to give more of it, you could increase the dose, but you definitely do not necessarily need to increase the frequency. Okay? Okay. So the action of what happens with this is that the action is, oh, did I miss it? Okay. So what this does is this causes the vata to move downwards. What it also does is it helps to let the stools be more watery. So for instance, there wouldn't be as much of dryness in the stools. So that's a good point that just brought up one contraindication. Avipatikara Churna actually probably should not be used in conditions of Pittaja Arśas and Raktaja Arśas. It is better to be used for Vātaja and Kaphaja Arśas, which again seems contradictory because Avipatikara Churna is typically used for Pitta. In this condition, you do not want to do that, because in this condition, it's not really going to help it. Because of the extreme heat exhibited by this formula, it will actually just make the Pittaja and Raktaja Arśas worse. Okay? So Avipatikara Churna can be used in Vātaja or Kaphaja types, but definitely you do not want to use this for a Pittaja or Raktaja type. Okay? You're better off just using Takra with a Pitta and a Raktaja type than Avipatikara Churna. Okay? The next is Abhayarishta. So Abhayarishta is the combination that is a fermented, it's an alcoholic drink, that it's a medicated alcohol that we make in Ayurveda. These are one type of formulas that we make. The alcohol content is somewhere like around 6 to 8%, very less than a beer or a little bit over a beer. It's never allowed to go beyond 10%. So the main ingredient in this is abhaya, which is haritaki. Abhaya is another name for haritaki. And that also does the same action of causing the stools to move downwards, or to cause the apana vata to move downwards. Now, this is not as strong as the Avipatikara Churna. So Abhaya Arishta is, though being a alcoholic preparation, is probably, it's an okay or safer choice for a Pittaja or a Raktaja Arśas. Okay? So for Pittaja or Raktaja Arśas, you can use Abhayarishta. For Vātaja, this can also be used for Vātaja and Kaphaja as well, in a more earlier stages or not as chronic stages. In a chronic stage for Kapha or Vata, you can even upgrade to Avipatikara Churna, but not for Rakta or Pitta. Okay? And the reason why this can be used for Rakta and Pitta is also because of the ingredients. The combination here is not as Ushna as the Avipatikara Churna. It's not as hot because it has grapes. Draksha is dry grapes, which is basically raisins. Vidanga is hot in potency. Madhuka is more mild, cooling. Jaggery is not as hot. It is hot, but not as hot. Gokshura is partially hot. Trivrit is, again, one of the major ingredients that causes the downward movement. Dhanyaka is coriander, which is not very hot. Dhataki is sort of medium, not hot or cold. Indravaruni, Chavya is kind of hot. Mishra is, Mishraya is fenugreek, which is actually slightly cooling. Mocharasa also is slightly cooling. Shunti is ginger, and Danti is another actually kind of hot drug that helps for downward movement. So this combination has a good balance between hot and cold, or Ushna Virya and Shita Virya. So it's not as bad or as strong as the Avipatikara Churna. Okay. So the indications for this is used actually for multiple conditions, for many different types of Vātaja disorders. It's used specifically for Arśas, also used in Udara, where there's the gassy distension of the abdomen, or even an ascites. Vibandha, even in constipation, and Mutra Bandha, where there's difficulty in urination. We even use Abhayarishtam for in some conditions where there is painful menstruation, or there is irregular menstruation, in order to initiate that movement of Apana Vata and to get that regulated back into a cycle, instead of having it, once every 2 months or once every 3 months. This again helps to get that Apana Vata moving in the right direction. So it can even be used for that as well. And the dose for this is almost always 30 ml after food. Again, the frequency of this can be determined according to the severity of the condition. If it's very chronic, then you can have it after each meal. If it is not as chronic, then you can have it after breakfast and dinner. If it is a very recent onset and not, more acute, then you can have it maybe just once a day, preferably in the Vata predominant time of the day, which is in the evening, so after dinner. Okay? Okay, so I know we don't have too much time left, but if you guys want to put in some of your questions, and we can try and get to as many questions as we can. And whichever questions we don't get to, we can either have it for the next session, or I can answer them in our Google group, or I can answer them through email for you. Okay? So I can now open it up for questions. I know we have quite a bit. So let me look at one of the earlier questions we had today. So colon polyps can be considered as Arśas? Yes, partially. We can consider those as Arśas as well. It's very similar presentation and a very similar causative factor. From the Ayurvedic perspective, yes, we can consider colon polyps as Arśas. Sesame seed and jaggery as a causative factor for Arśas. The reason why is because both of those two combined is extremely heavy to digest. And what it does is it causes further manda agni, or suppression of agni. So therefore it actually can cause development of Arśas as well. Okay. So just before, while I'm waiting for the people to put in their questions, the question for this webinar, to see if you're attending, is what is the first line of treatment for Arśas as per our scope of treatment? Okay. I was once recommended to take Avipatikara Churna for a week in increasing doses and decreasing doses for my heart. Does that make sense? Yes, absolutely. Because you can use this formula in multiple different ways. The whole point of using it in an increasing and decreasing dose is very similar somewhat to a rasayana effect. That procedure has been described in rasayana therapy in Ayurveda. And there's two types of rasayana. One is a cleansing rasayana, and one is a building rasayana. Okay, or one is a cleansing rasayana, and one is a nourishing rasayana. So this method of increasing and decreasing is known as a cleansing rasayana. And what it does is, what this is doing is, by using the Avipatikara Churna, it is slowly trying to get the Vata to move downwards. Typically, when we look at the functions of the heart, and this will actually come back to when we talk about cardiac disorders, even the functions of the heart and circulation is done by Vata, right? So that is done by Vyana Vata, the circulation throughout the body, and the movement of blood and getting the nutrients to all the appropriate places. Remember, Vata, all the subdoshas of Vata, Pitta, all the subdoshas of Pitta, and Kapha, all the subdoshas of Kapha, are ideally one and the same, Vata, Pitta, and Kapha. They're not exclusive to each other. So if Vata, any one aspect of Vata is moving in an odd direction, it can cause a change or a variation in the other types of Vata and their functions. So, for instance, if you can't affect the Vyana Vata, it's very hard for you to catch a hold of the Vyana Vata or to target the Vyana Vata. A method of trying to do an intervention with that is to get the other type of Vata, which you can intervene and have that start moving in its proper direction. And if you can coax that into moving into the proper direction, what automatically happens is the other types of Vata have to start following as well. Okay? So this is the idea of why using Avipatikara Churna for a heart condition is try to get the Vata moving downward. Try to get the Apana Vata moving downward. That will get all the other Vatas moving in the proper direction. And you do this in such a slow manner that you don't aggravate the Vata at the same time. Because remember, anything that you do aggressively to the body, immediately Vata also starts to react aggressively. So the best way whenever you want to do anything with Vata is, even though it may instinctively think, okay, let's be aggressive and let's do something strong because it's really chronic, we need something really strong. For the most part, you get a much longer sustained effect if you do it slowly. Because what happens is you can coax the Vata into moving in the direction you want, as well as a reaction from the Vata by inducing this change. So what this was doing is causing the Vata to move down slowly, 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 get all of the other subdoshas of Vata to also start moving in its proper direction. And so you slowly increase it and you slowly decrease the dose by tapering it off. So again, if you stop it immediately, there will again be a reaction. Again, Vata will increase and it'll cause a problem. So you see the effect, slowly increase it and then slowly decrease it. So the body just naturally goes along with this change and doesn't create any reactions. Okay, so even though you're using something that is very potent, by doing it this way, it doesn't create a side effect or an unwanted reaction. Okay? Okay. Are there any other questions? Like I said, if no one asks any questions, either you all understood everything we talked about or you understood absolutely nothing at all. I hope it's the first one.
Okay, it's looking like we're good. Thanks, Anusha.
You're
That was
welcome.
great.
Good.
Yeah.
I know I feel like there will be a lot of questions coming on, and that's okay. Don't feel overwhelmed if you look back on this and all of a sudden you're like, oh, I don't get this at all. I thought I understood it, but I don't. It's completely okay. It does take some time. It takes some time for your mind to digest all of this information, and then it's actually healthy for you to get questions. You should find that you're going to get questions. Then we're going to talk about it again. Then it'll again add another layer of understanding and another layer of understanding. Okay. Sure. I think we have like 2 minutes left. Sure. Why don't you go ahead and ask your question, Terry? Okay. Let me see here. Rakta instead of twak because it's affinity to skin. Is that correct? No, it is correct. It absolutely is correct to put in rakta instead of twak as well. You're right, because I did mention that in the video that twak is a byproduct of rakta. So for instance, when we went through the list of all the different dhatus and which are affected in the production of Arśas, absolutely. Rakta dhatu is affected, mamsa and medus, as well as obviously, even though we haven't mentioned it, but of course, rasa dhatu gets affected as well. So by putting in rakta, it's not wrong. It is still correct. You're welcome. Okay. Oh, good. So we made it just in time. So thank you everyone for being able to attend and going through the class today. Again, if you have any questions, feel free to send them to me or Hillary. We will try to answer your questions in the most efficient way. I think for next week's webinar, we should probably leave next week's webinar open to questions and leave it as a discussion time because we've covered a lot of material and I want you guys to have a chance to interact and to talk and for us to discuss these different situations. Okay, so next week's class, I'm going to leave that one open for us to have questions and discussion because I think that's going to be really helpful for you to be able to process all of this information before I start throwing more information at you. Okay, so I would suggest you go through your notes, go through some of your case studies, and sort of prepare some questions. And if you can send me these questions maybe a day or two in advance, then what we can do is we can pick out some of the common questions that maybe more than one or two of you have, and we can discuss that in the next class. Okay?
And Anusha, we changed the day from Wednesday to Tuesday, was it?
Not for next week. For next week, we're still on for the 22nd.
Okay.
It's the last week in June and the first week in July.
Okay.
It's only for those 2 weeks that we're on Tuesday, and after that we can go back to Wednesday again. It's just a conflict for me for some other programs. But apart from that, it's just for those 2 weeks.
Okay, very good. Well, thanks again, and good night, everybody. Good to see you all. I'm going to stop the recording.